Hello everyone, welcome to Sunya IAS and welcome to this lecture. A very important part of your preparation, that is your health sector, right? We have been talking about the health sector, and when you talk about the health sector, it is important from GS2 point of view, GS3 point of view, both. Within that health sector, the biggest problem that our country and the entire world is facing right now is non-communicable diseases. Now, it doesn't seem so because we were recently in the grip of COVID-19, which was a communicable disease. It was a pandemic and it engulfed the entire world. But COVID or no COVID, the pandemic of non communicable diseases has engulfed the entire world because non communicable diseases cannot be fit into one box. Okay, they are of all types, as they say, all sizes and shapes. Obesity is also a non communicable disease. Now, just think about the people who are obese around you. है ना, malnourishment is also a non communicable disease that way. ठीक है, बिकॉज इट विल लीड टू अनीमिया. तो ये सारी जो नॉन कम्युनिकेबल डिजीजेस हैं, एज वी विल गो फॉरवर्ड वी विल अंडरस्टैंड दैट दे आर द बिगेस्ट हेल्थ कंसर्न एज ऑफ नाउ. बिगेस्ट हेल्थ कंसर्न. ठीक है, देर इज नो डाउट अबाउट इट. एंड वन ऑफ द बिगेस्ट पार्ट्स ऑफ दिस नॉन कम्युनिकेबल डिजीज इज कैंसर. People don't understand, some people, and I have personally seen those people who have this misconception that cancer can be spread. Cancer cannot be spread. Yes, some genes are more prone to be struck by cancer, that is for sure. If there is family history of cancer, you are more prone to be struck by cancer. But overall, it's not a communicable disease. So cancer forms a big part of our non-communicable diseases category. And why we need to cover this topic very thoroughly is because this topic can come up as a separate question also. हेल्थ में बहुत कम चीज़ें हैं जो कि सेपरेट क्वेश्चन पूछी जा सकती हैं, एंड वी आर कवरिंग ऑल द क्वेश्चंस विच कैन बी कवर्ड सेपरेटली. क्योंकि जेनेरिक जब हेल्थ का सवाल आएगा, if there will be a generic question on health, that you can handle with the current data you have, with so much. We did a separate lecture on the data on health also, wherein we just talked about the health sector, and this is the data regarding the health sector. That all is done. But there are some sub questions, and that's why some of you might be thinking, why so many videos on health? The reason behind that is that you can get 10 markers, 15 markers on these topics of health, and ultimately it is all about how you tackle each question, how well you are prepared for each question that can come up, how deep research you have done for each topic that was in news. So non-communicable disease has been in news, and not just this year or the last year, for the past many years it has been in news. So before starting, let me just tell you how you can go about for the notes for this lecture. I always tell you in the beginning itself, so that there are no comments in the comment section about please give us the PDF, etc. Either you go for Sunya IAS books, Sunya IAS GS books, wherein all these topics will be in a compiled form. So for example, the health sector is covered in GS2, okay, social justice aspect. Or you can make handwritten notes as and when the lecture proceeds, okay. So we always display the pointers very crisply and very nicely in the same manner that we would expect you to write in your mains examination. So write it, and then more than writing it, the important thing is to revise it. So once you write it, first of all, write it in A4 size sheets, and as soon as you're done with it, maintain 4 separate folders. Okay, GS1, GS2, GS3, GS4. Maintain these 4 separate folders, and make sure that as soon as you write it, you just transfer your notes to that GS folder so that you can revise it properly. And within that GS folder, you also have to make pin pointers. So for example, health should be under one category, education should be under one category, vulnerable sections should be under one category. So that all, if you are comfortable with handwritten, you can go for handwritten. If not, all that compiled format is already there in the Sunya IAS book. So you can order the Sunya IAS books. Okay. Now I have told you about the notes. Now let's just come to the topic, non-communicable diseases. As is very clear by the name of it that they are not usually communicated by air or usually by contact. But there are some other features of non-communicable diseases, and we will be referring to non-communicable diseases as NCDs now. ठीक है? तो NCDs के कुछ बहुत distinctive features होते हैं. For example, they are long duration diseases. Long duration diseases. ठीक है? NCDs, आप कोई भी एग्जाम्पल ले लो, जैसे फॉर एग्जाम्पल हाइपरटेंशन ले लो आप. हाइपरटेंशन is a long duration disease. ऐसा नहीं है if someone is suffering from hypertension, they can recover within a month or two. If you are suffering from fever, etc., you can recover within a week, within a month maximum. Even dengue, chikungunya kind of things you can recover from. But these are the long-term things. They're lifetime. They become lifetime diseases. ठीक है? तो long duration होती है. एक और चीज, they are slow progression diseases. They are slow progression diseases. If you talk about cancer, cancer में क्या होते हैं? Stages होते हैं. The earlier you find out about the disease, the better it is for the cure. है ना? This is the way to go about cancer. इसीलिए बोला जाता है that even if you are feeling कि छोटा सा भी कहीं पे lump है or something like that is happening, then you should get it tested immediately, not be scared of it. So they are long tenure and slow progression diseases which have become a major cause of adult mortality. Major cause of adult mortality. They are primarily not the cause of child mortality or infant mortality, because as soon as a child is born, it's not that, it's very rare that they're already born with some disease. For example, childhood diabetes is one of the conditions which is increasing a lot nowadays. But overall, it is a major cause of adult mortality because non-communicable diseases mostly come from lifestyle based issues. ठीक है? We'll talk about it how. ठीक? After this, we need to write down some data, and this data will help you here and there because it is every data that you need for this particular topic. Every single data that you require for answering the question for non-communicable diseases, I'll cover it right now. And it's not that you have to write all the data in your examination. When your focus is too much on writing the data, na, you miss out on the substance, you miss out on the analysis. Some data is required, definitely, but not data only. Data only should not be your approach. ठीक है? So just write down the data that will help you, because आप 10 data points याद करोगे, आपको 2 या 3 या 5 याद रह पाएंगे. So WHO data tells us that globally, out of all the mortalities that we are having, all the deaths that we are having, 71% of those deaths are because of non-communicable diseases. Just think about the number of deaths, the proportion of deaths that is because of non-communicable diseases. 71%. No other killer, be it accidents, be it war, be it anything, no other killer is such a strong killer as non-communicable diseases. ठीक है? So basically, it's the same thing that every 7 out of 10 people who is dying globally is dying because of some or the other non-communicable diseases. So why do we give you these multiple data points? Simply because you can remember better. Do you have to write both these data points in your answer? No. A big no. Your space in UPSC answer sheet is so important that I cannot emphasize it enough, that how important it is. Okay, so don't write same data point more than once. Just make sure that you are writing it, just you are ingraining it very nicely. ठीक है. Another thing, the non-communicable diseases leads to premature death. Premature death means death of people between 30 to 69 years of age. ठीक है, बेसिकली 30 to 70 years of age ये जो लोग हैं, बिकॉज यू आप मान के चलते हैं, फॉर एग्जाम्पल इंडिया में भी द expected lifespan of a male has risen to be more than 69 years. ठीक है, तो आप एक एवरेज उस अगर 70 साल से पहले किसी की भी डेथ हो रही है, समवन इज डाइंग बिफोर 70 years of age, यू कंसिडर इट प्रीमेच्योर डेथ, कि वो एवरेज लाइफ स्पैन से पहले दे पास्ड अवे. सो ओवरऑल ग्लोबली more than 15 million people die because of non-communicable diseases. More than 15 million people die, and that is just between this. After that, after you reach 70 years of age, in whatever way you die, you have crossed the age that you were expected to live. तो वो फिर भी इतना हैवी नहीं होता है, बट एज लॉन्ग एज यू आर इन द वर्किंग एज ग्रुप, फॉर एग्जाम्पल वर्किंग एज ग्रुप में आप होते हैं 59 ईयर्स तक, 15 to 59. तो इफ समवन हैज डाइड इन दिस एज ग्रुप, दैट इज अ लॉस टू आवर डेमोग्राफिक डिविडेंड ऑल्सो. तो यहाँ पर 15 million डेथ्स अकर. देन this is very very important, and this shows the difference between a developed and a developing country. The low and middle income countries, we are a low income country, India. The low and middle income countries account for 77% of NCD burden. 77% of non-communicable diseases, NCD death burden in fact. तो कैंसर हो गया, हाइपरटेंशन हो गया, ओबेसिटी हो गया, ये सारी चीजें हैं तो डेवलप्ड वर्ल्ड में भी, बट देयर हेल्थ सिस्टम इज डेवलप्ड इनफ टू गिव देम प्रॉपर ट्रीटमेंट. इंडिया में वो सिनेरियो नहीं है, डेवलपिंग वर्ल्ड में वो सिनेरियो नहीं है. सो पीपल एंड अप डाइंग मोर बिकॉज ऑफ द नॉन कम्युनिकेबल डिजीजेस, एंड 77% of death burden is on countries like us, countries like India, Bangladesh, Pakistan, Sri Lanka, etc. Then a very important and again a striking fact, 1 in 28 deaths globally is happening because of diabetes. Okay? This is very important. And then comes the biggest silent killer, cancer. So 1 in 6 death is being caused by cancer. 1 in 6 deaths is being caused by cancer. And cancer is something which can develop from anything, right? It can develop from a sedentary lifestyle. It can develop from tobacco. It can develop from anything at all. So cancer is causing the death of 1 in 6 people. 1 in 6 people who are dying because of cancer. ठीक है? Then overall the respiratory and cardiovascular diseases, है ना, the respiratory and cardiovascular diseases, they are killing about 17.9 million people. ठीक है, 17.9 million people overall are dying because of that. So ये बहुत सारे statistics हैं, सारे लिखने की कोई जरूरत नहीं है. नोट्स में आप उतार सकते हैं, मेंस में आप सारे नहीं लिखेंगे, लिखने भी नहीं चाहिए. You would be using data which is giving a bigger impact. So for example, the data of premature death is giving a very strong impact, that our demographic dividend is being impacted. So even when you have, let's say, ordered the Sunya books or you have made the handwritten notes, it is your smartness that how much will you translate into that, and that requires multiple revisions. इंडिया रिलेटेड एस्पेक्ट्स पे आ जाते हैं. ये डेटा आपको थ्रू आउट काम आएगा. ठीक है, तो इंडिया रिलेटेड एस्पेक्ट्स यहाँ पे जो 71% था, डेथ्स ड्यू टू NCDs आर 70, सॉरी नॉट 71%, इट इज योर 63%. 63% of all deaths. अब ये कोई बहुत अच्छी बात नहीं है कि oh we should be happy that the proportion of deaths because of NCDs is less. There are many other reasons because of which deaths are happening. For example, road accidents. ठीक है, ये road accidents वाला aspect जो है it is lesser in the developed world and that is why their proportion is higher of NCDs. So anyway, 63% deaths in India are happening because of NCDs, and overall the share of NCDs has increased a lot. ठीक है, अब ये जो मैं डेटा पॉइंट बताने वाली हूँ इसका ये आप लिख नहीं पाएंगे in your examination, but just understand the gravity of it. That consider 2 years, 1990 to 2016. ठीक है, 1990 to 2016. उस समय पर जो हमारा 1990 में जो हमारा कंट्रीब्यूशन था कि 100 में से कितने लोग नॉन कम्युनिकेबल डिजीजेस की वजह से मर रहे हैं, इट वाज अराउंड 37%. ठीक है, इट वाज अबाउट 37%. इन 2016 इट इंक्रीज्ड टू 61%. And after 61% it has increased further. Right now it is 63%. ठीक है, तो 100 में से 60 से भी ज्यादा लोग जो है वो नॉन कम्युनिकेबल डिजीजेस की वजह से मर रहे हैं. डायबिटीज इज द बिगेस्ट प्रॉब्लम इन इंडिया, है ना. इनफैक्ट इंडिया इज कॉल्ड द डायबिटीज कैपिटल. यू वुड बी अवेयर ऑफ इट. हमारा कल्चर इस तरीके का है, वी हैव अ स्वीट टूथ ओवरऑल, एंड बिकॉज वी हैव अ स्वीट टूथ, हमारा जलेबी का कल्चर है, हमारा ये सारी चीजों का कल्चर है, एंड प्लस दैट पासिस ऑन हेरिडिटरी इन अ हेरिडिटरी मैनर ऑल्सो. ठीक है, तो चाइल्डहुड डायबिटीज भी इंडिया में बहुत बढ़ रहा है इस वजह से. सो डायबिटीज इंडिया में सबसे बड़ी प्रॉब्लम है. और आईसीएमआर की जो स्टडी है डायबिटीज पर ये आती रहती है. सो ओवरऑल हाउ मेनी पीपल इन इंडिया हैव डायबिटीज राइट नाउ? It is 101 million people in India have diabetes. And the bigger problem over here is that about 136 million people are pre-diabetic. That means, please write this down, that 101 million people, that means more than 10 crore people are diabetic, and about 136 million people, more than 13 crore people are on the verge of diabetes. So when you might have heard this a lot, ki they have high sugar, they have high cholesterol. अब जिसको high sugar होती है जरूरी नहीं है कि they are suffering from diabetes. You would not see the people who are suffering from high sugar levels to be taking insulin, है ना. But they are at a very high risk and a very high chance of developing diabetes, and they are classified into pre-diabetic. So जितने अभी डायबिटीज के मरीज हैं उससे ज्यादा डायबिटीज के मरीज बनने वाले हैं. दिस इज अ वेरी स्केरी सिचुएशन. And even these pre-diabetic people who are high on sugar and cholesterol, they are the ones who are still having medications, right? They might not be having insulin injections, but they're still having medications. They're having sugar control medications, and sugar control medications become lifetime medications. ठीक है, तो ये हो जाता है. So diabetes is a very big problem. Then between 2012 to 2030, one of the most golden decades of our country, and more than a decade, about 2 decades, one of the most golden times of our country, and in fact our Amrit Kal has already started, right? 25 years before our independence, the last 25 years before our independence, before 100 years of our independence. So इस period में हमारा we lost about 3.5, we are set to lose about $3.55 trillion due to non-communicable diseases. Just think about it. $5 trillion economy तो हमारा goal है. We have still not reached that goal. And we are losing $3.55 trillion in this much span of time because of non-communicable diseases. Because होता यही है कि when someone is not okay, when someone is sick, when someone's health is not giving them the support that they need, then they cannot be as productive at their work, and that becomes a problem. Okay. Then overall risk factors for NCDs. So in India, 2 in 5 adults have high risk of NCDs. So क्या होता है कि for example आप tobacco ले लीजिए, तो tobacco and tobacco related products are so easily available in our country. They are so easily, and in fact smoking is called the most addictive substance which is being abused right now, because it is so easily available. It's the easiest available substance to be abused. So that is why 2 out of 5 people, 2 out of 5 adults are exposed to risks of non-communicable diseases. Fine. So these are some of the data points that are India related. You have so many data points in front of you. Don't even think of remembering everything at this juncture, because it will not be possible. Take it down in your notes and make sure that you revise them again and again. Only then it will come naturally to you. Okay. Now let's come to why non-communicable diseases actually happen. This is one of the most important aspects of it. And this you have to write only if asked. Let's say आपको एक 10 मार्कर आया है और 10 मार्कर में आपसे पूछा जा रहा है कि what are the effective strategies? What are the effective strategies to tackle non-communicable diseases? ठीक है, तो आप ये फैक्टर्स या कॉजेज नहीं लिखेंगे नॉन कम्युनिकेबल डिजीजेस के, बिकॉज योर स्पेस इज वेरी इंपॉर्टेंट. ऐसा नहीं है कि जो पॉइंट आ रहा है वही लिख दिया. आई हैव सीन सो मेनी पीपल who come out of the mains hall and they contact and they say कि हमारा mains बहुत ही अच्छा हुआ है, and then when the result comes, mains का result, वो mains नहीं clear कर पाते हैं, and in the hindsight they realize कि this is not a CBSE exam. Okay, this is an exam to make you a bureaucrat. तो आपको जो नॉलेज है आप उसके बेसिस पे कैसा आंसर लिखते हैं वो इंपॉर्टेंट है. आपको जो नॉलेज है आप उसे आंसर में इंक्लूड कैसे करते हैं वो पॉइंट नहीं है. ठीक है. एंड as soon as you realize this difference, your entire approach to your preparation will change. You will not aim at remembering and recalling everything. You will aim at understanding everything. And because you have to understand everything, you will aim at revising everything. ठीक है, ये चलता है. तो बट स्टिल वी हैव टू अंडरस्टैंड. अगर सिर्फ ऐसा ही हो कि कुछ कुछ पॉइंटर्स पढ़ने से आप एक अच्छा मेंस का आंसर लिख देंगे, तो ऐसा भी नहीं हो सकता है, बिकॉज यू नीड टू हैव अ डेप्थ ऑफ अंडरस्टैंडिंग. सो overall why do non-communicable diseases actually happen? One is behavioral factors, and behavior जो है वो modify किया जा सकता है. So behavioral factors को आप modifiable factors भी बोल सकते हैं, right? So biggest is tobacco use. Biggest problem is tobacco use. The ease with which it is available, despite very clear laws, despite very clear warnings that tobacco is not to be used in public places, the ease with which it is available is just jarring. It is just unbelievable how easily tobacco is available and used in India, right? Then alcohol abuse is also increasing. Recently you would have known about this very famous actor called Matthew Perry. And there is no harm in writing case studies like this, at least in essay, है ना. अगर मान लो हेल्थ पे आपको कुछ ऐसे आ गया, तो आप अगर रिसेंटली जो चीज रही है माइंड में वो आप मेंशन कर देंगे, तो इट विल जस्ट शो दैट ओके यू आर अवेयर ऑफ द थियोरेटिकल एस्पेक्ट्स ऑफ इट एंड द पॉपुलर कल्चर ऑल्सो, एंड यू आर एबल टू derive the values, derive the lessons from the popular culture and apply it in administration. So the case of Matthew Perry is in point, who played Chandler in the sitcom Friends, ki what alcohol can do. And one thing regarding that we saw was, in the West, he was from US, so in the West there is such an open discussion on alcoholism there is such a regulated use of alcohol that even if someone is an alcoholic, there are proper rehabs to actually get them back to where they should be, in the social circle. But in India, अभी इंडिया की बात करते हैं, ओवरऑल ये थर्ड वर्ल्ड की प्रॉब्लम है. बट इन इंडिया द प्रॉब्लम इज दैट देर इज स्परियस अल्कोहल ऑल्सो. यू वुड हैव सीन कई बार ये केसेस आते हैं स्परियस अल्कोहल, है ना, स्पेशली इन प्लेसेस वेयर इन अल्कोहल इज बैंड. जैसे फॉर एग्जाम्पल बिहार इज अ ड्राई स्टेट, तो बिहार में ये जो लोकल अल्कोहल होती है इसके बहुत केसेस देखने को मिलते हैं, राइट. सो दैट इज देयर. सो अल्कोहल की अवेलेबिलिटी बहुत ईजी है ना, इन एनी एंड एवरी बजट दैट यू वांट, एंड अल्कोहल पे डिस्कशन बहुत कम है, राइट. सो दैट इज द प्रॉब्लम. देन physical inactivity is there, sedentary lifestyle, digital lifestyle that we are living, it is giving us a entirely sedentary approach. ठीक है, बचपन से ही बच्चे खेलना बहुत कम हो गए हैं आज की डेट में. And overall our unhealthy diet which is high on fats, ठीक है, trans fats that too. So ये आपके modifiable issues हैं why non-communicable diseases is changing. So and all the non-communicable diseases, most of them, they are interrelated. So it starts from obesity. Then if it is not solved, if you have not resolved the issue of obesity, then the issue of obesity will translate into cancer slowly. ठीक है, first it will translate into hypertension. If you are not able to do something about it, it will further translate into cancer. ठीक है, तो it is all a loop. Then environmental factors, air pollution, UV radiation. हमने देखा how every year during the Delhi winters and the Diwali season, what happens during the Parali burning season and the Diwali season, which they come together only. ठीक है, तो वो बहुत बड़ा इशू है. देन वी हैव नॉन मॉडिफाइबल फैक्टर्स, जैसे जेनेटिक फैक्टर्स होते हैं. लाइक आई टोल्ड यू कि बिकॉज सिकल सेल अनीमिया is more prevalent in tribal, is more prevalent in the tribal populations. अब उनकी generation जो है वो ज़्यादा prone होती जा रही है सिकल सेल अनीमिया के, right? And it is not the fault, it is not the lifestyle fault of the children. And वही वाली बात है कि it is not even, see, when you are in the government sector, your responsibility is to know that it is not even the fault of the people who are into tobacco use. It is our responsibility as the administration to give them that realization and to give them that incentive to actually leave tobacco or leave alcohol. ठीक है, तो ये आपको कभी भी एज अ ब्यूरोक्रेट नॉर्मल सिविलियन की तरह नहीं सोचना है. ठीक है, यू डू नॉट हैव टू हैव अ क्रिबिंग एटीट्यूड, यू हैव टू हैव अ प्रॉब्लम सॉल्विंग एटीट्यूड. दिस इज वेरी इंपॉर्टेंट. ठीक है, फिर मेटाबॉलिक फैक्टर्स आ जाते हैं. व्हेन योर डाइट इज इनसफिशिएंट एंड योर सेडेंटरी लाइफस्टाइल इज देयर, देन योर मेटाबॉलिज्म आल्सो रिड्यूसेस, एंड व्हेन फैट कीप्स ऑन कलेक्टिंग एंड इट इज नॉट डाइजेस्टेड, देन इट लीड्स टू डिजीजेस. Then other factors, there's urbanization is there, globalization, educational levels are low, and poverty is high. So these are generic factors, and COVID-19 also has aggravated some of the factors. ठीक है, COVID-19 का सबसे बड़ा impact हुआ है mental health पे. And it's a very interesting question that I'd like to ask you कि what do you think, mental health एक separate basket तो है ही health में, but if we were to classify it, would we classify it as a communicable disease or a non-communicable disease? Listen to me very carefully, in the sense that many times people are suffering from mental health diseases, but they are not aware. It shows in their behavior. For example, if let's say someone is very violent, that is a mental health issue. Fine. If you make that person aware, you have communicated something to them. Do you think it's a communicable disease that they are now able to understand that, oh, I need treatment for this? This is a very interesting debate also that goes on. But of course, mental health overall is a very individual disease. It's a very, It is a non-communicable disease, but yes, like we saw during COVID-19, so many people together, because of the situations in the environment and because of the isolation, they suffered with depression, right? So that way it was communicable. Yes, now we come to impact. This is the section जो कि आपको एग्जाम में लिखना ही लिखना है. No matter what the question is regarding non-communicable diseases, you need to show the gravity of the situation before giving the solutions to it. ठीक है. तो impact में एक loop बन जाता है. For example, the poor cannot afford medications for blood pressure, sugar, etc., and that further reduces their capacity to keep working, and that leads to poverty. So it's a loop. So it leads to poverty, it leads to decrease in national income and loss of household income as well. ठीक है, जैसे मैंने बोला था कि जो आपकी डिस्पोजेबल इनकम है, डिस्पोजेबल इनकम जब आपकी कम हो जाएगी बिकॉज ऑफ नॉन कम्युनिकेबल डिजीजेस, जस्ट थिंक अबाउट इट, थिंक इन योर फैमिली. आई एम श्योर सम ऑफ यू do have some people in or around your family who are suffering from high blood pressure, sugar, diabetes, high cholesterol, and these kind of diseases, right? They don't even know it's a disease. It's just a condition for them. है ना, वो एक लाइफस्टाइल बन चुका है कि सुबह उठना है, ब्लड प्रेशर की गोली लेनी है, एंड देन शुगर की गोली लेनी है, देन यू हैव टू मूव फॉरवर्ड विद योर डे. सोशल इम्पैक्ट भी होता है इसका, बिकॉज सम पीपल हैव हायर एक्सेस टू दीज facilities to get them resolved, some people don't, so it leads to social inequality also. It leads to impact on hunger and education also, and overall impact on healthcare system, because even the tests for non-communicable diseases are very expensive. If we talk about cancer, and specifically let me talk about the cancer which is a very big problem for women, the breast cancer. तो ब्रेस्ट कैंसर को टेस्ट करने के लिए एक टेस्ट होता है जिससे बोलते हैं हम मैमोग्राफी. मैमोग्राफी बोलते हैं. मैमोग्राफी इज वेरी एक्सपेंसिव, है ना. सिमिलरली इफ यू वांट टू नो anything about the inside of your body, you need to get an MRI scan. MRI scan is very expensive. तो अल्टीमेटली है क्या कि नॉन कम्युनिकेबल डिजीज की वजह से आपका ओवरऑल सोशल स्ट्रक्चर पे इम्पैक्ट आ रहा है, राइट. दैट इज देयर. देन इट ऑफ कोर्स इन इंडिया इट लीड्स टू 63% of total deaths. We know that by now. And it hampers our SDG fulfillment. The Sustainable Development Goal 3 talks about good health and well-being, right? When we are not able to resolve the problem of non-communicable diseases, we are actually falling behind on SDG 3.4. ठीक है, SDG 3.4 which is talking about the non-communicable diseases. तो ये impact हैं इकोनॉमिक, सोशल, एसडीजी वाइज. इसको आप इंटरनेशनल भी बोल सकते हैं, ठीक है, इंटरनेशनल या ग्लोबल इम्पैक्ट, एंड ओवरऑल इम्पैक्ट ऑन हेल्थ सेक्टर ऑफ इंडिया. नाउ लेट्स कम टू वेरी इंपॉर्टेंट एस्पेक्ट, दैट इज स्टेप्स टेकन. क्योंकि हमने बहुत स्टेप्स लिए हैं इस डायरेक्शन में रिसेंट टाइम्स में, और है ना. अर्लियर वी यूज्ड टू जस्ट टेक इट फॉर ग्रांटेड कि ठीक है नॉन कम्युनिकेबल डिजीज है, एंड ओबेसिटी जैसी चीज़ों को बिल्कुल भी हम लोग सीरियसली नहीं ले रहे थे. बट लेटली वी हैव रियलाइज्ड दैट दीज थिंग्स एक्चुअली स्पाइरल इनटू फर्दर diseases. So that's why we have taken some very substantive steps. Before I write it down, just think about कि क्या क्या डोमेन में हमने स्टेप्स लिए हैं नॉन कम्युनिकेबल डिजीजेस के लिए. नॉन कम्युनिकेबल डिजीजेस में सबसे बड़ा जो इम्पैक्ट है वो अवेयरनेस का होता है, ठीक है. फॉर एग्जाम्पल हमने ईट राइट मूवमेंट चलाया है, राइट. टोटल पोलर कंपाउंड्स पे हमने कैप लगाया है. वी हैव पुट अप अ कैप ऑन ट्रांस फैट्स, ठीक है. सो ईट राइट मूवमेंट चल रहा है हमारा. फिर फिट इंडिया मूवमेंट भी हमारा चल रहा है, राइट, वेर इन वी आर ऑल्सो टॉकिंग अबाउट एस्पेक्ट्स लाइक योगा. फिर प्रिवेंटिव हेल्थ केयर में हमारा आयुष्मान भारत, प्राइमरी हेल्थ केयर सेंटर्स भी हैं। प्राइमरी हेल्थ केयर सेंटर्स में एक बहुत बड़ा एस्पेक्ट जो आता है वो ये आता है कि इफ समवन इज सफरिंग फ्रॉम अ मेजर डिजीज और समथिंग विच रिक्वायर्स द इंटरवेंशन ऑफ हायर हेल्थ अथॉरिटीज, तो आप उनको रेफर भी करें हायर हेल्थ अथॉरिटीज पे, राइट? सो जस्ट थिंक अबाउट हाउ मेनी इनिशिएटिव्स आर देयर, पॉज इट, थिंक अबाउट इट, एंड यू विल बी एबल टू रिलेट अ लॉट ऑफ द पॉइंट्स जो अभी हम कवर करेंगे, ठीक है? जस्ट पॉज द वीडियो, think about the points, and I hope you have done that. ठीक है, एक एक करके देखते हैं। नेशनल स्टेप्स क्या लिए गए हैं? नेशनल प्रोग्राम फॉर प्रिवेंशन एंड कंट्रोल ऑफ कैंसर, डायबिटीज, कार्डियोवैस्कुलर डिजीज एंड स्ट्रोक, NPCDCS 2010। ठीक है, आप ये बिल्कुल भी एज इट इज नहीं लिखेंगे इन योर मेंस एग्जामिनेशन, क्योंकि ये आपके एक पॉइंट का एक एग्जाम्पल होगा। तो यू कैन सिंपली राइट NPCDCS, ठीक है, और आप ब्रैकेट में लिख सकते हैं अगेंस्ट डायबिटीज, कैंसर एक्सेट्रा, ठीक है, ये लिख सकते हैं आप। देन नेशनल हेल्थ पॉलिसी, जिसमें बात की गई थी 2.5% GDP पर लेकर जाना है एक्सपेंस, ठीक। नेशनल एक्शन प्लान, WHO फ्रेमवर्क फॉर टोबैको कंट्रोल, वेरी इंपॉर्टेंट, ठीक है, इससे हमने we have complied with the WHO framework for tobacco control. अगर आपने देखा हो कभी भी after the government regulations, even the alcohol पे वो warnings नहीं आते हैं, but on tobacco products पे काफी बड़े warnings आने शुरू हो गए हैं कि how dangerous they can be, right? That should happen even for alcohol, but that has not happened yet. ठीक है, then आयुष्मान भारत, Indian Hypertension Management Initiative, then there is Fit India movement, we talked about it. Affordable medicines and reliable implants for treatment, Deen Dayal awareness initiative and overall awareness initiatives, ठीक है। तो ये कुछ initiatives हैं जो important हो जाते हैं। इसके अलावा एक और है पोषण माह, there is Poshan Abhiyan, right? So within that, one of the initiatives is Poshan Ma, that is the Poshan month, the nutrition month, wherein initiatives will be taken to let everyone know how important it is to have a good nutritious diet, ठीक है। Then इसी में awareness initiatives में ही आपका eat right भी आ जाता है। ये कुछ national initiatives हैं। आपको यहां पे दिख रहा होगा दैट देयर इज सम गैप दैट नीड्स टू बी फिल्ड व्हेन इट कम्स टू नॉन कम्युनिकेबल डिजीजेस। जैसे हमारा एक पूरा फ्रेमवर्क बना फॉर कोविड-19 पैंडेमिक, है ना, हम वैक्सीनेशन करेंगे, देयर हैज टू बी अ प्रॉपर आरोग्य सेतु ऐप बनाया हमने, सो मेनी थिंग्स वी वांटेड टू एलिमिनेट इट। दैट हार्ड हेडेड अप्रोच इज रिक्वायर्ड फॉर द नॉन कम्युनिकेबल डिजीजेस एज वेल, ठीक है, सो दैट इज नीडेड। अब ग्लोबल इनिशिएटिव्स पर आते हैं। ग्लोबली क्या इनिशिएटिव्स लिए गए हैं? देयर इज ग्लोबल एक्शन प्लान फॉर प्रिवेंशन एंड कंट्रोल ऑफ NCDs 2013 to 2020, इसका टाइमलाइन जा चुका है। Global Compact on NCDs, Global Non-Communicable Diseases Network, then there is NCD Alliance, then there is United Nations High Level Meeting on NCDs and United Nations Interagency Task Force on the Prevention and Control of NCDs. इसमें हमेशा ये याद रखना कि जो यूनाइटेड नेशंस के इनिशिएटिव्स हैं वो टॉप पे आने चाहिए, है ना। as soon as you start writing you mention about United Nations high level meeting on NCDs. It is very important that you do that, ठीक है। so these are some of the initiatives. इसको आप just mention कर दें, कुछ भी explain करने की जरूरत नहीं है when you write them, because ultimately each of these initiatives is doing the same thing, just to ensure that non-communicable diseases are reduced, ठीक है, सबका गोल वही है। so इसको कहीं भी explain नहीं करना है, don't waste your mains. in fact इंटरनेशनल में आपको हार्डली 2 इनिशिएटिव्स लिखने हैं. नेशनल इनिशिएटिव्स यू राइट 4 to 5 इनिशिएटिव्स. सो ओवरऑल यू विल हैव 6 to 7 इनिशिएटिव्स टू मेंशन. ठीक है, ये स्टेप्स लिए गए हैं और स्टेप्स टेकन भी आपके आंसर का एक बहुत इंपॉर्टेंट हिस्सा है. बिकॉज अगर आप वो नहीं लिखते हैं, यू कम ऑफ एज इग्नोरेंट टू द एग्जामिनर दैट वी हैव टेकन सो मेनी स्टेप्स एंड स्टिल दिस पर्सन इज नॉट अवेयर ऑफ इट. ठीक है, तो ये है. नाउ द मोस्ट इंपॉर्टेंट पार्ट ऑन विच यू विल बी एक्चुअली असेस्ड. यूपीएससी के मेंस में हमेशा आपकी नॉलेज असेस होती है बाय द वे यू मेंशन योर प्रॉब्लम्स, बाय द वे यू मेंशन योर इनिशिएटिव्स टेकन. बट जो आपका ब्यूरोक्रेटिक नैक है, वेदर यू कैन बी अ ब्यूरोक्रेट और नॉट, वो हमेशा टेस्ट होता है बाय द वे फॉरवर्ड सेक्शन. ठीक है, तो वे फॉरवर्ड को हमेशा बहुत ही अच्छे से, बहुत ही पैशनेटली लिखो और प्रैक्टिकली भी लिखो, है ना. फॉर एग्जाम्पल, अगर आप इम्प्रैक्टिकल होके ये लिख दोगे कि लेट्स से यू बैन जंक फूड, अगर आपने ऐसा कोई सजेशन दे दिया, ये पैशनेट सजेशन है बट ये प्रैक्टिकल नहीं है. दिस इज नॉट समथिंग दैट अ ब्यूरोक्रेट वुड से, राइट. इंस्टेड यू से रेगुलेट फास्ट फूड इंडस्ट्री, रेगुलेट फास्ट फूड इंडस्ट्री. एग्जाम्पल, लिमिटेशन ऑन ट्रांस फैट, है ना. ये एक ऐसी चीज है जो थोड़ी सेंस बना रही है कि आप बैन नहीं कर रहे बट यू नो द इम्पैक्ट ऑफ द जंक फूड इंडस्ट्री एंड द फास्ट फूड इंडस्ट्री, तो आप उस पर जो है कुछ रेगुलेशंस, कुछ लिमिटेशंस लगा रहे हैं. दिस इज ब्यूरोक्रेटिक लैंग्वेज, ओके, एंड यू नीड टू अप्लाई ब्यूरोक्रेटिक लैंग्वेज. ठीक बात है ना. चलिए, नाउ लेट्स सी वन बाय वन. सो द इजीएस्ट वे टू एलिमिनेट, not eliminate but reduce, substantially reduce, is to reduce tobacco use. हमने बहुत कोशिशें की हैं tobacco use कम करने की, but unfortunately the ease of availability of tobacco is such. and एक और reason जो है कि popular culture में टोबैको इतना यूज किया जा रहा है, इतना यूज किया जा रहा है that it has become a status symbol also of sorts. ठीक है, it has become very exotic to use tobacco products, but it is a disease, it is an addiction. No matter how cheap the tobacco product is that you are using, it is still an addiction. ठीक है, तो your as an administrator, as let's say tomorrow you become the health secretary, you have to reduce tobacco use in the sense that no matter how much revenue you are gaining as a government from tobacco, you are losing out a lot of your human resources also. ठीक, so even popular culture has to be regulated. आपको पता होगा कि जो बिग स्क्रीन पर जो सिनेमा में स्मोकिंग के सीन्स होते हैं या ड्रिंकिंग के सीन्स होते हैं, इनके नीचे एक एडवाइजरी आती है दैट स्मोकिंग इज इंजूरियस टू हेल्थ. नाउ दीज एडवाइजरीज आर नॉट रियली वर्किंग, ये प्रूव हो चुका है. be it ads, be it anything, it's not working. So you have to choose some other strategies. What can be the other strategies? That there are role models, create role models now. Create role models, because in India we have a lot of we have a culture of following. We are huge followers of people, we worship people, you know, people like Rajnikant, etc. So whichever people are actually not engaging in smoking, etc., they should come forward, है ना. Reduce harmful use of alcohol. India में alcohol is not a social drink. There are episodic drinking episodes. India में क्या होता है, episodic drinking होती है. In the West, alcohol is a social drink. It is very widely accepted also, and it is taken in very small quantities. India mein the scenario is that it is taken sometimes, and when it is taken in very huge quantities, right? So that leads to a very negative impact on your liver. So that is there. So that needs to be regulated, and regulated इसमें भी जो हमने strategy use की है with tobacco products, we should be trying that with alcohol also. That is advisory. advisory on labels is required. ठीक है, so that is there. Then what else can we do? Reduce unhealthy diet, and that will happen through the eat right movement, and that will happen from the time of your school itself. So school children from itself, अभी जैसे recently ये चीज बोली गई थी that within 50 meters of the school the junk food will not be sold. अब यहाँ पर बोला जाता है कि यू नो दिस इज हैम्परिंग फ्री बिजनेस एक्सेट्रा, बट इट इज अबाउट द हेल्थ ऑफ आवर फ्यूचर, हेल्थ ऑफ आवर चिल्ड्रन. हाउ कैन वी मेस विद दैट? वी कैन नॉट, राइट? सो दैट इज देयर. देन वी नीड टू रिड्यूस फिजिकल इनएक्टिविटी. इसके लिए क्या आएगा काम? योगा. ठीक. Manage cardiovascular diseases and diabetes through, first of all, early diagnosis and then proper management and not just medication. ठीक है, तो for these cardiovascular and diabetes, जैसे अभी heart attacks के cases बहुत ज़्यादा बढ़ रहे हैं, right? And this is happening post COVID a lot. So you need to have therapy for that, therapy and counseling, that what are the symptoms that you are facing. And management of cancer, extremely important. And cancer का mantra यही है that you detect it as soon as possible, to start the treatment as soon as possible. And now there are many other ways of tackling cancer as well. जैसे chemotherapy जो है, that is a very destructive way of killing cancer cells. So there is CAR T therapy that has come up. CAR T therapy that has come up for, just read about it, you will find it very interesting. It is not as destructive as cancer is. So ये CAR T therapy जैसी चीजें कैसे आती हैं? वो तभी आती हैं when research is done. और research कब हो पाती है? जब research scholars को enough stipend मिलता है, right? So it just understand every problem at its micro level and you will be able to arrive at a solution at the macro level. ठीक है? Other steps that can be taken, we should ensure that we are living and working conditions are conducive for all. And इसमें sanitation का बहुत important हिस्सा है. ठीक है? Because sanitation leads to communicable as well as non-communicable disease. The lack of sanitation leads to communicable as well as non-communicable diseases. ठीक है? अब जैसे antimicrobial resistance है. एंटीमाइक्रोबियल रेजिस्टेंस को आप कहाँ क्लासिफाई करेंगे? बिकॉज एंटीमाइक्रोबियल रेजिस्टेंस इज वेरी पर्सनल इन नेचर. यू आर हैविंग ओवर द काउंटर पिल्स एंड दैट इज लीडिंग टू एंटीमाइक्रोबियल रेजिस्टेंस. बट इफ यू आर लिविंग इन अ वेरी डर्टी सराउंडिंग, है ना, योर बॉडी इज ऑलरेडी इम्यून टू अ लॉट ऑफ माइक्रोब्स, सो मेडिसिन आर नॉट वर्किंग फॉर यू. ठीक है, तो एंटीमाइक्रोबियल रेजिस्टेंस. तो लिविंग एंड वर्किंग कंडीशंस नीड टू बी कंड्यूसिव फॉर ऑल. Health in all policies approach, whichever policy we bring forward. जैसे liquor licensing के ऊपर बहुत बड़ी अभी debate चली थी. अभी a politician, very famous politician of Delhi has been jailed also. But इसमें इसकी कोई बात नहीं कर रहा है that how liquor drinking is harmful and how we can reduce that. क्या liquor shops पर आपको लिखा हुआ मिलता है that liquor is harmful for health? No, right? चाहे वो 100 में से एक इंसान को डेटर करे, बट देन डेटर तो करेगा ना, दैट मैटर्स. ठीक है, सो दैट इज देयर. देन कम्युनिटी आउटरीच एंड एम्पावरमेंट इज वेरी इंपॉर्टेंट, स्पेशली इन केसेस लाइक कैंसर, वेर इन cancer is a very personal disease. The pain is personal, the suffering is personal, but the impact is on the entire family, है ना? The people, as soon as the people around you realize that you have cancer, during your treatment or after the treatment is over and unfortunately the person has passed away, it is very painful for the family. So community has to be involved. Similarly, things like high blood pressure, they are not just a condition, they are a disease, and for that community involvement is needed so that that disease can be detected in early phases. Then ensure reliable health data. As we have data related to NCD, we need to break down that data as well. ठीक है, जो for example हम बोलते हैं कि हमने बोला 136 मिलियन प्री डायबिटिक्स हैं. अब प्री डायबिटिक्स में who are those people? Why are they termed as pre-diabetic? Do they have high sugar, high cholesterol? So that needs to be broken down. Then leverage WHO supporter health information platform. जैसे अपना आयुष्मान भारत डिजिटल हेल्थ मिशन है ना, वो इसी लाइंस पे है. हेल्थ इंफॉर्मेशन प्लेटफॉर्म ऑफ WHO tells a lot about various kind of non-communicable and communicable diseases that are prevalent across the world. तो इस पर जो इंफॉर्मेशन दी गई है, जैसे कोविड के टाइम पे अ लॉट वाज बीइंग शेयर्ड कॉन्स्टेंटली विद द पब्लिक ओवर हियर. ठीक है, इवन एक पोर्टल भी बनाया गया था वेर इन ग्लोबली हाउ मेनी पीपल हैव डाइड ऑफ कोविड, इसका एक रिकॉर्ड रियल टाइम में मेंटेन किया जा रहा था. तो सिंस एनसीडी इज द लार्जेस्ट किलर, दिस काइंड ऑफ अ ग्लोबल रिकॉर्ड हैज टू बी मेंटेन्ड, राइट. एंड ओवरऑल we can see the best practices of Zambia and Tuvalu. Zambia में क्या हुआ है कि HIV और सर्वाइकल कैंसर के लिए, HIV और सर्वाइकल कैंसर के लिए अर्ली स्क्रीनिंग का प्रोविजन किया गया है ना. अर्ली स्क्रीनिंग, प्री स्क्रीनिंग, बिकॉज अर्ली स्क्रीनिंग में ऑल्दो एक्सपेंस उसमें भी जाएगा स्क्रीन करने में, बट देन जो लेटर स्टेजेस के एक्सपेंसेस हैं वो कम हो जाएंगे काफी हद तक. सो जाम्बिया में अर्ली स्क्रीनिंग की गई थी, बिकॉज ऑफ विच अबाउट 1 लाख women have been able to avoid the this progressive disease because early stages पे उनका डिटेक्ट हो गया. एंड ओवरऑल तुवालू में ये हुआ है कि तुवालू की जो रेड क्रॉस सोसाइटी है, Red Cross Society of Tuvalu, this Red Cross Society of Tuvalu has created a bottom up approach. जैसे हमारा पंचायती राज है, वैसे ही वहां पे भी उन्होंने bottom up approach रखा है, so that they can ask the people at the bottom what are they suffering from, what is restricting them from performing their livelihood, etc., and then they can work upon it, right? So yes, that is all about the non-communicable diseases. I am again reminding you that a separate question can come up on non-communicable diseases because आपने खुद ही देख लिया है that it is such a big problem कि एक separate question आना कोई बहुत बड़ी बात नहीं होगी. In fact, जितने भी वीडियोस हमने यहाँ पे इस सेशन में कवर किए हैं हेल्थ के ऊपर, सभी पे किसी ना किसी साल सेपरेट क्वेश्चन आ सकता है बिकॉज ये सभी करंट अफेयर्स में है. तो हमेशा मेंस में जो सवाल आता है वो मिक्स्ड करके आता है, एक थीम पूछा जाता है और उस थीम का एक स्पेसिफिक ऑफशूट पूछा जाता है आपसे, राइट. सो मेक श्योर दैट यू कंप्लीट योर नोट्स from this lecture or from the Sunya IAS books. And yes, I hope you derived value out of this lecture overall. I will see you all in the next one. Take care everyone and thank you for watching. Bye bye.